So, welcome everyone. Our episode on mental health and wellness. I'll be your moderator, Laura Avellino, and I'm here with Dr. Shaneel Shah. Dr. Shaneel Shah is an American board member of the Psychiatry and Neurology board certified in adult psychiatry since 2013 and child and adolescent psychiatry since 2014. He has treated adults, children, and adolescents with mental health challenges for the last 14 years. Dr. Shah has also served in the U.S. Military Army Reserve as a psychiatrist. He completed medical school in India and his residency in psychiatry in SUNY Downstate Medical Center, Brooklyn, New York. After his residency, he did a fellowship in child and adolescent psychiatry at Mount Sinai St. Luke Roosevelt Hospital in New York, New York. Dr. Shah specializes in anxiety disorders, depression, mood disorders, relationship issues, PTSD, autism, and ADHD. He is passionate about his work and strives to provide the best possible care in person or virtually. Dr. Shah states that any treatment is incomplete if it ignores the wants and needs of the recipient. By avoiding the cookie cutter approach in providing mental health treatment, his goal is to generate individualized solutions to your symptoms collaboratively. Welcome, Dr. Shah.
Happy to be here, Laura.
So, for today, our learning objectives are defining mental health, the importance of mental health in the daily life, common mental health challenges. Dr. Shah, we would like to get to know our Garnet Hospital providers. Would you like to tell us something interesting about you?
You already said about my professional work. Yes, I'm a psychiatrist. I like music. I used to sing, not anymore, but I used to. And I like to read. I like to watch shows in theater. Hiking, something I enjoy. So.
Thank you so much for sharing. That's wonderful. Hopefully, we get to hear some of your music. So let's get into it. So, what is mental health?
So, if you go to the WHO definition of mental health, the World Health Organization, it's the or WHO definition of the health, it is mental, physical well-being of an individual. So, broadly speaking, I would say mental health is, there are two main areas of our life, right? We work and then we have a family. And
Mhm.
if you are able to enjoy what you do, and have a family life where you feel loved and your ability to love, then you have a good mental health. And that's the definition that Professor Freud or Sigmund Freud started with. That most people struggle with either at work or at home life. And if you can strike balance between the two as an individual, then generally speaking, you have a good mental health. Mental health does not mean absence of anxiety, sadness, and I'm sure we'll talk about it later on, but that's part of normal life. That's part of the emotional life cycle. We if you receive a bad news, you feel sad, and that's normal. So mental health does not mean absence of those things, but your ability to keep going and lead a meaningful life, I would say, is a sign of good mental health.
Thank you so much. And what is included in mental health? And I know
So
you touched a little bit on it.
yeah, so that's similar to what we are talking about, ability to have that fulfillment in life. Viktor Frankl was a prominent psychiatrist, and he wrote a book on logotherapy or meaning of life, and he talked about ability to achieve a meaningful life, find a meaning and purpose to what we do in our lives, is part of mental health. When you experience a stress, everyone does, everyone will at some point. How do you overcome that? How do you get out of that? So what we call resilience, that's part of mental health. Happiness obviously is mental health. I say that no one is getting up every morning, jumping out of bed, feeling enthusiastic every day. I mean, if that happens, that's good, but no one is doing that every single day. But at the same time, you want to feel like you look forward to your days. You want to feel good about what you do. Um, no one is in love with their spouse or kids every time. There are times when your kids will annoy you, or your spouse will get into fight. Um, that doesn't mean there is absence of mental health. So it's easy to define what mental health is not, um,
Yeah.
but if you have a good relationship with your family, um, recently I read somewhere that if people you care about and love you back, and they are in your life, that's a sign of a meaningful, healthy life in general. Now,
That,
I know we divide mental health and physical health, but it's not to be looked at in isolation. As the end, at the end, it's the same body, right? So, um, if people have physical pain, chronic pain, then that often affects mental health as well. So, mental health goes along with the physical health. If you have a healthy body, that often leads to healthy mind.
mm, thank you so much. And what credentials or licenses are needed for a mental health professional?
Yeah, that's a good question. I often get these questions from patients as well. So you have a psychiatrist, someone like me. We go through medical school, then we do specialized training in psychiatry. As someone can become a cardiologist, someone chooses to become a rheumatologist, surgeon, gynecologist. Similarly, psychiatrists, we choose to do residency in psychiatry, which is typically 4 years long. Some of us then decide to specialize. Um, for example, I have specialized in child psychiatry. Someone can work with forensic population, which is related to legal matters and
Mm,
mental health. Someone does geriatric psychiatry. Someone specializes in addiction and things like that. So that's a psychiatrist, which is MD or DO as a credential, which you will see after the name. Then we have psychologists. Psychiatrists, we can prescribe medications, we diagnose different mental health conditions, and we can also do therapy. Also, in this day and age, most psychiatrists, we limit ourselves to medications, but we also do therapy. Psychologists, in contrast, are mostly they do therapy. They also can diagnose. Some psychologists specialize in what we call neuropsychological evaluation, which are lengthy evaluations for autism, ADHD, or dementia or other things, depending on whatever might be going on. Those are PhDs or PsyDs.
mm,
PhDs are more research focused. Then you have psychologists working in school-based settings. After that, you have social workers. Typically, you're looking for licensed mental health social workers. So it's MSW or LMSW.
mhm,
Um, they do more counseling, I would say. And then you have all kinds of other credentials of people who do therapy. There is licensed practitioner, counselors, and I see a lot of other mm, credentials and letters after people's names, which I don't even recognize. But essentially, they do therapy. They'll talk to someone. So what we call psychotherapy or talk therapy. Um, and I would say those are and then you have mid-level practitioners like nurse practitioners or physician assistant PAs.
mhm.
They also typically work with psychiatrists and do med management or prescribing medications and overseeing treatment.
Okay. Well, that's very important because we want to make sure the patients really know where they're going. And it also involves a lot of education, as you mentioned, with the different
Yeah,
credentials.
people often confuse between psychiatry and psychologist. So
Hmm.
psychiatrists are, as I said, people who have gone through medical school and we can prescribe medication. And psychologists do more therapy and they can also do more specialized testing.
But no prescribing.
Generally speaking, yes. Yeah.
Okay. Perfect. Thank you so much. What are some of the most common mental health challenges that people face today, in your opinion?
I mean, anxiety and depression are the commonest challenges that we face as a population across the age range. Anxiety is very common these days. I mean, we have so many things going on in our lives. We lead very busy lives.
Yes.
I like to say we don't have much space left on our plate, so if any other stress is added to our life, we get overwhelmed. Anxiety gets very common. And again, everyone gets anxious from time to time. Some
Mm,
people get anxious about public speaking. I mean, some people get anxious about test taking. Some get anxious about something else, flying, for example, or driving. And some people are anxious more in a persistent way. So everyone gets anxious from time to time.
Mhm.
But if it's more pervasive and if it affects your quality of life, usually what happens is if you are anxious and you try to avoid things that make you anxious, then you limit your quality of life, right? For example, if someone always want to go on stage and I don't know talk about things, but they're so anxious they don't want to do it. Well, that's they're limiting their quality of life. Or someone is I have a patient who is so anxious that he didn't leave his house for a year. Now, obviously, is affecting that's affecting his quality of life. So anxiety is common in that way. Depression is very common. They often go hand in hand, anxiety and depression. um, ADHD has become common these days because of a lot of awareness being raised in that. We have so many distractions in our lives these days, cell phones, internet, news, other things that people get distracted easily, and some people have it so that they have ADHD.
Mhm.
Um, but I would say if I had to choose two, I would say anxiety and depression.
Okay, perfect. Thank you. And we spoke about the common challenges. What are some effective coping strategies for stress and anxiety?
That's a good question. And you mentioned stress here. So stress is important to manage. A lot of times we get stressed for different reasons. Sometimes we take on more than we can, handle. Sometimes life throws more things at us, whether that's in terms of financial stress or social stress. Car breaks down, rent is high, kids are not doing well in life, or someone we love
Yeah.
passes away, or whatever might be going on. It's important to monitor. I call it sort of stress index. So it's nice for us to ask ourselves, where am I on my stress level on a scale of 1 to 10? 10 is the highest stress you've ever faced, and 1 is you're not stressed at all. And if it gets above a certain number, like 7, 8, 9, if it persistently stays there, then you need to do something to manage it. um, Simple things can help. Spending even 10 minutes a day in self-care can help a lot. I like to tell people that even walking out, or walking in nature in the morning for 5-10 minutes, if you can spend that time for yourself, can help. Working out obviously can help. Meditation, yoga, anything that doesn't involve screen time and that's not related to any addictive behavior,
Mm.
like smoking, drinking. Some people resort to those things in order to manage stress or de-stress at the end of the day, but that doesn't help in the long run. um, so anything that's healthier, painting, some people like music, having a hobby that doesn't require much resources, doesn't require company or finances, can help. Spending time in nature, I think, is a great way to de-stress. But it's important to manage that stress level. If it persistently stays high, then it's a problem. And we are not meant to deal with persistent stress, biologically. That's where it leads to, we're talking about body-mind connection. That's where it leads to all kinds of physical symptoms, reduced energy, aches and pains, headache, stomach ulcers. Um, all those things can happen if we are persistently stressed. Blood pressure can come along as well. Um, so
Well, that's a lot of consequences from living in high stress, but that's a good point about gauging your stress level.
exactly, it's important that we ask ourselves, once
Mhm.
a week maybe, or if you're really not feeling good, or if you're getting more irritable, you're snapping easily at people, um, or you just feel like you want to cry or don't feel motivated. Where am I on my stress scale? And if it's too high, you want to bring it back down.
Yeah, that's excellent. Self-awareness.
Mhm.
Thank you. And what is the difference between depression versus day-to-day sadness, in your opinion?
Day-to-day sadness is pervasive. We all have it from time to time. No one can say they don't experience sadness. Sometimes, in fact, when we treat depression, some people feel more flat with the medication. Sometimes it's a side effect and they don't like it. So,
Mm.
I had a patient recently said her dog died and she couldn't cry. She couldn't feel that sadness and she didn't like it. So, sadness is part of normal emotional life. Depression is persistent sadness that doesn't go away. When you start blaming yourself for things that you shouldn't blame, or you feel like you don't have enough energy, motivation to do things. So you could feel sad but still keep going with your life and still have the enthusiasm. When someone passes away, you feel sad, you grieve the loss, but at the same time, you don't start blaming yourself, hopefully. In depression, people start engaging in self-blame, over self-criticism. Um, you don't feel you have enough energy, motivation. You don't enjoy things that you used to enjoy before. Um, and sometimes, you at mild level, people do things they have to do, but beyond that, they don't want to do anything else. They want to stay in bed, or if someone invites you over, you don't want to go and spend time with them. So people become isolate, because
Mm.
part of depression is when you do things, it doesn't give you as much joy as it used to. So after a while, naturally, people start asking, well, why bother? If it's not will give me happiness, I don't want to do it. And then people start restricting their life, and that doesn't help with depression. The difference between anxiety and depression, I like to say, is, anxiety kind of screams to your face, so you cannot ignore it. But depression, a patient told me, is kind of sits in the background, in a in a corner of a room quietly. So sometimes we don't notice when we are depressed, especially if it's mild level. Um,
Okay.
and Sometimes when we treat people's anxiety, depression becomes more, it comes to the front, and then it becomes more noticeable. Um, so, um, so that's sort of mild. Then at moderate level or severe level, sometimes people have difficulty getting out of bed. They start losing weight because they don't feel like eating anymore. Some people don't sleep as much. And It's important that we treat depression as early as possible, because longer it goes without being treated,
Mhm.
sometimes it can become more treatment resistant.
A follow-up question. How long should or how long would it be for someone to consider themselves like, "Oh, I've been sad for a week or 2," so that, if I speak with my doctor, is that considered would I be diagnosed with depression, or does it have to be for a longer extended time than like 2, 3 weeks?
So for a major depressive episode, the cutoff is 2 weeks. So if
Mhm.
it goes on for longer than 2 weeks, then we can, along with some other symptoms being present, duration is not the only criteria, but the
Mhm.
other symptoms, some of which we talked about, is present, then we can qualify that as a major depressive episode. Now, that's where it's important to talk to your doctor, right? Because let's say if something stressful is going on, someone had to foreclose their house and filing for bankruptcy. Well, yeah, if they are sad for more than 2 weeks, I mean, that's understandable. But at the
Mhm.
same time, you don't want some of the other symptoms to be present.
Right.
So if we strictly look at the duration, it's greater than 2 weeks for a major depressive episode. But then you can have what we call unspecified depression, which is not lasting as long, or
Mhm.
someone doesn't have that many symptoms, but you're still feeling depressed, and not just the daily sadness. Daily sadness is typically transient, and you can still enjoy things. So you could feel sad, but at the same time, if someone plays a good piece of music, I can still feel happiness, as
Mhm.
opposed to depression, where that ability kind of goes down and it's harder to enjoy things.
Okay. Thank you so much. Definitely, you made that very clear and with the differences. Thank you. So we're at almost the end. What are some resources available at Garnet Health?
So we have our outpatient clinic, where people can go make appointment to see a psychiatrist, psychologist, social worker, as we distinguished earlier.
Mm-hmm.
So we have medication management. We could also provide therapy. Um, if someone needs inpatient hospitalization, we do have adult inpatient unit. We don't have inpatient unit for children and adolescents, but we do treat these people in the emergency room, and then we can refer them to a hospital they do treat teenagers.
Okay.
We have our emergency room. We have the main emergency room, but then we have a psychiatric emergency room called Access Center. In fact,
Oh,
that's where I work. So if someone has a psychiatric emergency, they can always come to the emergency room and then get treatment. Of course, it's 24/7 open.
okay.
Um,
That's important to know in case you ever have um
Absolutely, yeah. 988, I want to say, is the national suicide hotline number, by the way. So if at any
988.
time, yeah, now it's a national hotline for suicide. And
Mm-hmm.
so if anyone is having any suicidal thoughts, or 988 24/7, they can call them, text them. So it's a
That is
good resource to
very
have.
good to know. That's a very good tip. So, if anyone watching our episode today has any questions, we have an email provided here where we can send your questions to Dr. Shah. There's also some contact information, some numbers for Garnet Health in different locations where you can either make an appointment if you don't have a psychiatrist or in need of one. These numbers can help you find one. Is that correct, Dr. Shah? Should a person, if they feel some sort of symptom and they want to speak to someone, should they contact their provider first? And then is it referral based?
I think it depends on the insurance. So some
Okay.
insurances require that your primary care refer you to a psychiatrist, and
Hmm.
primary care physician is generally a good place to start.
Okay.
Um,
Perfect.
some insurances don't require that, and you can directly reach a psychiatrist and make an appointment. It's like any insurance. If you can reach a specialist without
Mhm.
primary care referral, that means you can see a psychiatrist as well. So,
Perfect. Thank you.
mhm.
So don't wait for to make your next appointment if you need. Again, these are other contacts for different medical centers that work with Garnet Health. Thank you so much for joining us today. And I wanted to share a disclaimer. The information shared here is simply to, broaden our information on mental health. It's not to substitute your treatment with your provider. Dr. Shah, thank you so much again for giving us your time.
My pleasure, Laura. Thank you for having me.
Thank you.